Hi guys, my name is Katrina.
And my name is Daria. Today's our guest is Iryna. Iryna is a certified trichologist and she's working as truly your hair and scalp clinic. Thank you so much, Iryna, for coming today. We can't wait to ask you all of the questions we have.
Before we start, I just want to say thank you for having me today. And hopefully I can help to guide you through the hair and scalp routine and help to grow our hair more healthy and shiny.
So my first question is, when I was growing up, I naturally have pretty long and thick hair, and they're very long and sleek. So when I was growing up as a kid, I was told by my mother and a lot of experts around me that if I start to wash my hair more often, they will start to falling out. I will have more like greasy hair. And naturally, I thought because I have a good hair, when I was growing up into adult, I was just like, yeah, it works fine with me. Like I have a fantastic hair and it's all because I wash my hair once a week. I'm pretty sure it's a myth. So I want to ask you, how often should we actually wash our hair?
That's the question that I have all the time in my consultations. We need to think about our scalp the way we think about our skin. How often do you wash your skin?
Every day.
Every day. Yes. So it depends on your scalp type. The answer is if your scalp is oily, you need to wash your hair more frequently. Even every day. That's fine.
Okay.
To wash your hair every day. Also, it depends what kind of shampoo are you using, of course. But if you have oily scalp type, you have to wash your hair. Please. Please, you have to wash your hair. So it's a myth when someone tells you do not wash your hair, because if you will wash your hair more frequently, more often, you can train it. You can grow your hair longer. No, it's totally wrong information. So we have to wash our hair. Absolutely, 100%. Please.
Yeah, as you mentioned, like training. So I've heard, and on Instagram and on TikTok, when they say like you can train your hair. So they say you just need to survive this couple of weeks and then you will need to wash it less frequently. It's like, this is the aim. This is the goal, to wash it less frequently. I don't know why, but okay, let's say we want to do like less washes per week. But is it possible to train your hair? Like you will just survive this like 2-3 weeks and then it's gonna produce, I guess, less oil? Or is it possible?
Unfortunately, no.
Okay.
Unfortunately, it's impossible.
Okay.
It's impossible.
It makes a lot of sense now.
Yes. The reason why, because we have the specific glands inside of our scalp. It's called sweat glands and sebaceous glands. And these glands, they're working. They're producing the sweat and sebum to the surface, to the scalp. So can you imagine that you don't wash your face, like you put the makeup, do not wash your face, you put makeup, do not wash your face. What happened with your face?
Oh, that's
It's
horrible. Yeah.
it can clogged and it can be inflamed. The same way we're thinking about our scalp, that all the time our glands are working and produce the sebum. However, we have the dust and environment and dry shampoo and all of this, all of the product that we put for our hair to style it. So we make it even worse that when we are not washing our scalp. So we cannot train our scalp to be no washed.
Yeah. What about the dry shampoo? Like, I understand that it helps like to make it look kind of like refreshed a little bit, but you mentioned that it's a buildup as well, so it actually clogs your pores, I guess. And how often you can use that? I guess it's not that good actually to use the dry shampoo.
I think I'm not that person that I will tell that, oh, you cannot use this or this. We are putting a lot of product I'm sorry, for our face and for our hair. We just need to understand that when you apply the dry shampoo for your hair, you need to wash it out after. For sure, the frequency of using the dry shampoo, it should be like once a week probably, when you are busy with your life, or you need to go out and you just need to use the dry shampoo. It's fine, but not in the everyday base. So what does it mean? That you're not washing your scalp and hair. You are not washing, you're just using the shampoo, the dry shampoo all the time, every day. So what's happened? Your scalp is working, your glands are working, and now you put something on top of it. You just clogged it together, and you have like really good environment for the germs to grow again. Sorry. So you can use the dry shampoo, but you need to wash it out.
I know there's like most of the problems and why people want to train their hair, to wash it less frequently, because they have the problem they need to wash their hair more often, like every day. So on the contrary, I have a dry scalp.
How do you know that you have dry scalp?
Well, first of all, because as you mentioned, I should treat it as my skin. I have a dry skin on my body and my face.
Okay.
So I think it's dry. Also, I am flaking.
So first of all, we need definitely know what scalp environment we have, because sometimes we think that our scalp is dry, but it is not. Your hair can feel dry, but scalp is oily.
Okay.
So first of all, we need to identify what scalp exactly you have.
Okay.
Because sometimes we are misunderstanding. We think that our scalp is dry, but it is not.
And how can you do that? How can you identify it?
Yeah, so we have the specific equipment to measure the oilness of your scalp. Yes, so we can tell you have dry scalp, you have balanced scalp, or you have oily scalp type. And moreover, we are using the trichoscopic pictures. It's a specific magnifying camera that can tell me that I just go close to the hair follicle, and I can see if your scalp is dry, if your scalp is flaky. The scalp is an extension for our face. So we have our own scalp environment as well. Of course, we need to treat scalp the way we treat our skin, but it's differently. So we need to have exfoliation, we need to have sometimes 2 shampoo to clean our scalp. And of course, it's depend on the scalp type. We need to use different product after for the hair growth, for the oil control, for the dandruff, and all of that type.
Interesting. So you mentioned also like exfoliating your skin.
Yeah.
I know that there are some, peeling solutions.
Like or scrubs.
Or scrubs. I actually used to have one. I don't know why I stopped using that, but I kind of loved the feeling after. And I think it even helped my hair to stay fresh longer. Even though you cannot train it, but I think the scrub, like it kind of helped to keep it fresh for a little bit longer than usual. Is it actually like how often you can use it?
When we talk about the scalp, of course, we need to understand your scalp type first, and only after we can tell definitely what product you need to use. In general, we have like a peeling, but we have different texture of it. So we have the scrub. So the small, you can feel it in general in the scrubs, like a small balls. Yes. So when we have thin hair, be honest with you, I'm not really recommending using the scrub for the thin hair, because can you imagine that all of this thin strength and you put the scrub on top of it, so you can damage your hair as well. So we have different texture of the product. For the scalp peeling, we have a solution, we have mask, we have cream. So again, it's depend of how scalp is and how the texture hair as well. So for the thin hair, fine hair, I'm not sure that the scrub is a good idea.
You see, and I was doing that.
Yeah. First of all, understand what is it. We need to take a look to see how many hairs growing from one hair follicle and a diameter for all of that hair as well. Because if it's, let's say, one hair follicle and let's say one small hair growing from that hair follicle, and you will scrub it in.
Yeah.
Oh, poor hair. Poor hair, save my life. So we need to be gentle in that way. We need to apply like a solution, like liquid. Yes. It also, the idea is the same, exfoliating. But if we compare thin hair to coarse hair,
Yeah.
yes, when we have the from one hair follicle growing like 2, 3, we need use something to wash it clearly with your hands and with specific scalp massager as well to remove all of that buildup.
You mentioned the scalp massager.
Yes.
Okay. So I want to know, I started using it, I think a couple of years ago. So could the hair scrubber damage the hair as well if it's very fine and thin?
I don't think so. So we just need gently massaging your scalp all over around, not like
That's
this.
me. I'm you.
Yes. So and usually we recommend to do like if you want to improve the microcirculation, you just need to be gentle, but you need to do the scalp massager all over around your scalp. With the scalp massager, the idea is just physically remove the buildup. So you need to be careful with this tool in general, but you can absolutely use it.
Yeah, it helps with my wrinkles on my forehead. I think because you stimulate the blood circulation, and I noticed that it actually improves. Yeah, it took at least 6 months to see the change, but when I noticed, I was like, wow! And it was just because of this little thing that I was doing like almost every day.
Such a wonderful question. The reason why, because when we do the scalp massager, we need understand a little bit of anatomy for the scalp. So you have muscles. So you have frontal area, you have temporal area, and occipital area. It's in the back. So usually when you need to do the scalp massager in general, so you just need go like this.
Right.
Yes. So that's why it is helpful to move your skin as well. When you started doing here, yes, and in the back. You're absolutely right. The scalp massager can improve the wrinkles on the forehead.
What is the most common problem that people come to you?
I think it's scalp issues and hair falling out. It's a pandemic for a whole world. The reason why, because of the environment, unfortunately, COVID, vaccine, and I think not really good scalp hygiene and not understanding the proper scalp type that you have may cause the hair falling out. Hair follicle, it's a tissue in our body, and our body think it's unnecessary tissue. You can live without it. It's not an emergency. You're not going to die. Yes, you can be bald.
It's like dead skin, right?
Yes, in general. So you can live without your hair up to 100 years in general, but it's a tissue for us. It gives us identity and confidence the way we look like. When the hair falling out, it's really complicated process that happening in our body, and it's influence different group. Youngest patient that I have, it's 5 years old up to 85.
I also have a question about the hair loss. So when I had a baby, my hair was like, even during my pregnancy, because everyone told me during your pregnancy, like hormones change, like your hair will fall out, your teeth will fall out, like everything will like gonna like
Destroyed.
Yeah. And I'm like, oh my God. But during the pregnancy, my hair was like thick and nice and shiny, and I was like, whoa, it's actually changed it like for better. But then after I had a baby, I noticed like how my hair became different. First of all, it changed the color, so now I have to dye my hair. Before that, it was like this before going to the hairstylist. So now I have to dye my hair, and you can tell even on the pictures I had like the line when it changed the color. And when I noticed that, I was like, oh my God, I have to go to someone, you know, to the hairdresser to fix this. But that's not the point. Like, I could live with that. But my hair loss, it became more after I gave birth, and it never came back. So I never could, you know, restore it to the previous years when I never had like too much hair because it's very thin and it's blonde. You know, it's been like 3 years, and still I cannot get that volume back.
When she is pregnant, we have baby inside. So the most important hormones is estrogen, and it gives our body and baby the most nutrition ingredient to grow. Yes, because the baby should grow for 9 months.
Yeah.
So your hair is growing as well. There's why when you deliver your baby, all of that hormones drop down. So you don't have the most nutrition ingredients that possibly be in your body in general during the pregnancy. And when you when you deliver the baby, all of that estrogen drops down. Now we just need to think that it's called postpartum hair loss, and it can be from 3 to 6 months, but sometimes it can be chronic as well. What does it mean? That we have the hair cycle. So your hair follicle producing the hair all the time. So we have the anagen, catagen, and telogen hair. But its cycle can be a little bit shorter. Let's say it was 5 years. One hair can live inside of your scalp for 3 years, let's say this way. Now it becomes thinner in a diameter, and the life of this hair is shorter as well. So there is why the first step is just do the blood work to understand if you're deficient in some point. And of course the scalp environment for sure. And when we know what's going on inside of your body with blood work, so it's internal part of it and external part of it, and move forward to create the specific treatment plan to grow your hair thicker, stronger, nicer, because it's a tissue. Yeah, so we can work with it, absolutely.
I also heard, like, I'm not sure if it's true or not, but you can tell me if at some point you start doing injections in your scalp, that's it. There is no way back. Like, you will have to do it until you die. Like, otherwise your hair will fall out. So if, let's say, that's why it's actually, I was scared to go to anyone and do like and getting the treatments because okay, what if I need the injections and then I will just stay on those injections like for the rest of my life, which I'm very scared of. So is it true that actually, like, if you start doing this, that's how you can keep it, otherwise you're gonna lose like your hair?
I would like to answer this question this way. You need to do something for your hair as a habit in your life. Is it topical solution that you can use at home when you apply it directly to your scalp? Yes. When we work intradermal, it's injections, or we have transepidermal delivery, or we have different treatments for the hair to grow back. We have to do something for our hair, yes, as a habit in your life. But it's not meaning that when you start doing something, when you stop it, all of your hair falling out.
Yeah.
Not really.
Okay, good.
Only, however, all of us, a lot of people know the minoxidil. It's a specific solution that we are using.
I've heard about that. Yeah.
Yes, but we need to understand we have different type of the hair loss and different scalp issues. So before using anything, we need to understand what we're dealing with first, and only after we can tell what should you do. It's a minoxidil, it's a whatever the cases is.
Yeah.
So in general, we work in the 3 directions. So it's a topical, it's injections, it's intradermal treatment, and a medication for the hair loss as well. But it depends of your type of the hair loss. But we have different hair prosthetics and different type of the wigs or toppers that helps people feel better with the hair in general. So we have different solution for everybody. I would like to say this way. It's depend how person feels, what she or he wants, and how can we help him or her to feel better.
Can we also talk products? So because there is so much stuff right now that they recommend for your hair, and I actually use a lot, and I feel like it helps, so like to keep them nice and shiny. But sometimes I feel like some of them are useless. But does it really help? Like, is it healthy, or it's just marketing as well?
I always make a comparison. The way you think about your skin. What are you using for your skin?
Yeah, so I wash it, and then let's say toner. Then I use serum, eye cream, and then I have either like night cream, so it's more like it's thicker, and I have like a lighter version in the morning, so I use that, and then I use SPF.
Okay, 7. Wow. Yeah, and what about the mask and this and this?
Well,
Okay.
that's once a week.
Yes.
yeah.
So we need to think about our scalp the same way we're thinking about our skin. We need to wash it. So to also, it depends for the scalp type you have. We're using the pre-wash sometimes. It can be once in a week or once in 10 days that you're using pre-wash. What does it mean? That before shower, you apply some like exfoliating product to your scalp, massage it in, leave it for a couple of minutes, and after rinse it well, and after you start using the shampoo. The shampoo you should have like just 2 shampoo, clarifying shampoo and just pH control. With clarifying shampoo, you remove the buildup more, especially when you style your hair, when you put the dry shampoo or whatever product you put on. And another shampoo is just the pH level control. So it's 2 kinds of the shampoo. And after, it's just, I talk about the scalp. Yeah. So you can use hair growth serum to the scalp or oil control or whatever the case is. But what's happening with your hair now, you need to use like mask, conditioner, and I would like to say the heat protecting, like 5 product, yes. Pre-wash, like a peeling, shampoo, mask, conditioner, and heat protector. And of course, we have a lot of product as well. But I think this 5 should be more than enough to keep the scalp healthier and your hair as well, as much as it possible.
Okay, 2 questions about sleep. So can we sleep with wet hair? And I know it breaks the hair, but what it does to the scalp, I don't know. And the other one with the sleep, do silk pillowcases help?
Yes.
Because I sleep on those, and I want to know the answer. Does it help or no?
Yes.
I hope yes.
Yes, it is. Yes, you're absolutely right. So please, no one can sleep with wet hair. Please.
I can't. That's the only way I dry my
No, you always should or towel dry your scalp. As example, when the wall is dry, you don't have the germs growing up. When the wall is wet, what's happening? The germs start growing at the wall. Yes.
Okay.
Oh my God.
So the same thing we are thinking about our scalp. It should be dry because if it's wet, it can cause itchiness, irritation, build up. It's not healthy. So please never go to sleep with wet hair. The silk pillowcases, it's amazing tool, amazing pillow that we have nowadays. It's excellent. It's helping with the wrinkles for your face as well. Pillowcases, it's really helpful investment in your sleep as well, not only for your hair but for your skin as well. However, when you go to the sleep, you need braid your hair as well. So sometimes when we fix all of these triggers that can cause the scalp irritation and hair loss, your hair become better.
Iryna, so let's sum up our conversation. We need to treat our skin on our scalp as our skin, not our hair. So it's 2 different things because our hair is a dead skin cells and the scalp is actual live skin cells. So it's 2 different things. So we apply different products on our scalp and on our hair. We need to brush our hair. We need to wash our hair.
We need to wash our brushes.
No training. Wash our brushes with soap. Never, always blow dry your hair before you go to sleep. It's always has to be dry. Scalp has to be dry. It's nice to use a pillowcase, but you don't have to. But if you have it, it's nice.
And our guests know where to find you. So you work at Truly You hair clinic.
Yes.
So actually, where is the clinic?
It's located in Mississauga.
We're gonna tag Iryna's account under this video, so you can, if you have any other questions, you can either put it in the comments below, or you can talk to Iryna directly. She's very helpful. I ask her a lot of questions as well. I feel like I'm gonna be coming to you soon with my husband and with myself, because I feel like I have this all scalp problems. It's just because I'm not
And apparently I
I'm
have
not
hair
doing
loss
the right
problem.
hygiene for my scalp. I feel like this is why, not because
That is
there's-
helpful.
Yeah.
Yeah, it's always helpful to speak with a specialist who actually can explain to you what is happening to you and like if it's normal or not, because apparently it wasn't normal to lose that much hair after my pregnancy. So we'll see if I can, bring it back.
Hopefully.
Yeah.
I believe so. I hope so. We can
Yeah.
try at least.
Yeah, you see, yeah, exactly. We can try at least, because there are like a bunch of treatments. Thank you so much for your time
you so
and for your input. I'm sure like every girl, every woman, and even men, if they watch us, I don't know, they will find it very insightful and very helpful to them. So thank you so much.
Thank you so much.
I appreciate your time that you are having me today. Hopefully, this conversation will help for someone as well. That's why we are here. And yeah, thank you.
Thank you so much, Iryna.
Класс. Я
Yeah.
столько нового узнала вообще.
Прекрасно.
Хорошо себя чувствуете?
Прекрасно.
Да?
Вообще идеально.